Hello and good afternoon. Thank you all for joining us today for our webinar focusing on elevating VA healthcare, harnessing healthcare simulation, standards of best practice for improved outcomes. Before we kick off the webinar, I want to share a few housekeeping notes. Please note that the recording will be shared with you after the webinar via email. If you have any questions throughout the webinar, please use the Q&A box located below. And if you would like to share any resources or have general conversations with the panelists or other attendees, please feel free to do that within the chat box. We will not be monitoring the chat box for questions, so if you can please just reserve that space for the Q&A box, that would be really helpful. So with that, I will turn the mic over to Laerdal's VA expert, John Gillespie.
Thank you, Helen. Good afternoon, ladies and gentlemen, distinguished VA administrators, educators, and healthcare professionals. Welcome to our transformative webinar, Elevating VA Healthcare, Harnessing Healthcare Simulation Standards of Best Practice for Improved Outcomes. Today, we embark on an insightful journey into the world of healthcare simulation, where innovation meets excellence in delivering healthcare to our esteemed veterans. In this engaging session, we'll explore how the Department of Veterans Affairs can leverage the evidence-based healthcare simulation standards of best practice to enhance the quality, safety, and effectiveness of care. Our guest speaker today is Dr. Penni Watts. She will guide us through the key standards that hold the power to reshape the landscape of VA healthcare. Topics for today's webinar include simulation design, patient safety, simulation enhanced IPE, objectives and outcomes, professional development, and last, optimizing resources for success. This webinar is not just an opportunity to gain knowledge, it's a call to action. We're here to inspire change, to challenge the status quo, and to unlock the full potential of the healthcare standards of best practice. Together, we will transform the way that we deliver healthcare to our nation's heroes, making it safer, more effective, and of the highest quality. So without further ado, let's dive into this journey of discovery and innovation as we strive to provide our veterans with the healthcare they truly deserve. Thank you for being a part of this important discussion. Without further ado, Dr. Watts.
Thank you so much, John. I appreciate being able to speak to everyone today. And yes, I am from way down south in Alabama. I'm at the University of Alabama at Birmingham. We're not the football team. We have a good one, but we're not Alabama. We're to the east a little bit. And I'm currently the assistant dean at UAB School of Nursing in Birmingham, Alabama. And I've been in the School of Nursing for 17, 18 years, and my history is as a nurse, critical care, ER. Actually worked at the VA for a year as a Valor student, if anyone remembers or still has the Valor students there. So I did want to tell you I am past chair of the ENACSL Standards Committee. It's International Nursing Association for Simulation, and worked on the recent edition of the standards. And so today I want to provide just an overview, because we could really get deep into these about the standards. But first, I really want to find out what you guys know about the standards. And so I think we're going to have a poll that will pop up here in just a second. Helen's going to be helping me with the slides. So if you guys wouldn't just say just a few seconds, there's only one or two questions on here to answer about what you know about the standards. So we'll let you take a few seconds to vote for that. Helen, does it look like we're getting folks typing in on that? I just can't see on my end, so.
Yes. Sorry, Penny.
Right.
Yeah.
That's okay.
So it looks like the numbers are slowing down. So we're at 43%, 43% say yes, and 58% say no.
Okay. Great. Thank you.
You're welcome.
All right. Let me get that off my screen really quick. So thanks everyone for participating. So let's see. Oh, here it comes. It's 42% yes, familiar with the standards, excellent, and 58% no, related to knowledge of the standards. So I appreciate you participating in that because we have had these standards for around 11 or 12 years, and many people don't know that they are around. And so today I want to kind of briefly, like I said, give you kind of a quick overview of what they are, how we can use them, and really use them to standardize and provide consistency across our program. And these standards are, our committee was an international, interprofessional group that took the standards, dug into the literature, into the research and the evidence, and really revised them, and we developed 2 new ones as well. So listed on the screen are all of the standards. I didn't put the glossary up here because it will probably be going away, but I listed all the current standards that have been around for a while, but there's 2 new ones, which is the pre-briefing and the professional development standard, which we'll talk just a little bit about in a minute. But the standards are to be used in practice, in academia, wherever, to guide your practice in simulation. Now, if you know anything about them, they're a couple of pages long on each one of them. So this is the gold standard. These are things to strive towards, but we know every situation and center has different aspects that they may not be able to attain some of these. So it's also a document, these are also documents that can help support you in your program and in your practice to help guide and not recreate things on your own. And we'll talk a little bit more about that. So just briefly, here are, you guys can see the screen, sort of the overview of the standards. So next slide, Helen. So just a quick history moment about the standards. In 2011, there were a group of experts that got together and said, hey, let's get together and come up with something for the simulationists in the world. Like, we're doing this, it's not putting a mannequin in a room anymore. And it's really surprising when I teach my sim class, my graduate class, oh my goodness, I didn't realize so much went into developing a really good simulation. So they got together and developed some key core standards. And over the next 10, 12 years, there were second, third editions. There was an operations standard added. And then 2021, we released the 4th edition of the healthcare simulation standards of best practice. We went through a name change. Originally, it was the Anaxel standards of best practice, and everyone thought they're just for nurses. The nurses made them up. But actually, they're not. They're applicable in any setting that you may be in for all professions. So we changed the name to Healthcare Simulation Standards of Best Practice. And we're going to talk a little bit more in depth about several of them. So next slide. So let's talk about standards. We're in healthcare, right? Every profession, nursing care, respiratory, medicine, we all have evidence-based guidelines we have to adhere to, right? For practice, for caring for wounds or IV administration, dressing changes, those type things. The same applies to simulation as well. The standards provide evidence-based guidelines for implementing, developing those as we take those into the practice setting and into academia. The standards share best practices that have been pulled together. Also, the standards were reviewed and endorsed by over 25 simulation groups, associations around the world from many different countries. And all of this, there will be a QR code later that you can take a look at that will show you a lot of that information. Also, this helps us advance the science of simulation. And although I can't see all of you right now, many of you who started out 15, 20 years ago with a mannequin out of a box in a closet, right? And where a one-man show may still be a one-man show. And we've really come a long way. So I really want to introduce you to the standards and kind of expose you to where we can take it next. So, all right, next slide. So again, the standards are really kind of a detailed process for you to pull out each one. They're each a different article. Actually, they're published free of charge on the website. It's part of the Clinical Simulation and Nursing Journal. They just happen to be housed there. You can pull one out and really take a deep dive into it, to evaluating your systems, your processes, your simulation design, and integrating these standards into your practice of simulation really shows your commitment to quality and excellence in providing best practice in conducting these experiences, which ultimately lead to my ultimate goal and all of yours is improving patient care. Next slide. So I want to tell you a little bit about me, and I want to kind of pull all of this together for you a little bit. So I want to talk about fishing, and I specifically want to talk about offshore fishing, well, and inshore a little bit. So I love fishing, and I have a little place on the Gulf of Mexico in a little Gulf town called Orange Beach, Alabama, and we're about a half a mile from the Gulf. And even as a child, here's a beautiful picture of me on the bank of either a river or a lake fishing. I've been fishing since I was a little girl, and as I got older and got married, I married a fisherman. Loved it. We have a boat that we can go out in, and when I got to thinking about my love and about fishing and all that goes into fishing, and there's more than just grabbing a reel and getting a worm or squid or whatever else you might be fishing with, there's more to it. And here with my fancy glove, and yes, I wear gloves, and I'm still a fisherman. So next slide, Helen. So let's talk about tools for success for fishing. Okay, you don't just hop in your boat and go out in the middle of the ocean, the Gulf of Mexico for offshore fishing. There's a lot of planning. There's a lot of gathering the right equipment. There's preparation, and there's several things you need to be successful in fishing. You know, years ago, it was my cane pole and a worm off the side of the lake. But going offshore, it's a little more complicated than that. And you never quit learning. My husband is my key fisherman. He's up there in the top left-hand picture. When I think about tools for success, you need a really good fisherman to teach you and be your expert. So I have my husband who lives and dreams this and watches every video there is around on it. You also have to have a boat to get you where you're going to go. Notice on the top right, I have some little toolkits with me. They have weights and hooks and all kinds of different things that we will need, spinners that we might need when we go out fishing. Of course, two types of fishing poles. Now, mind you, I didn't realize there are thousands of types of fishing poles, and I'm still learning. I will never be an expert, but I learn something all the time. So you have to have specific fishing poles to catch specific fish and different weights. And so making sure we have all of this ready when we go out fishing. And I had to brag a little bit. A couple of years ago, in the bottom left-hand picture, that's my husband, my son-in-law, and my son. We went out red snapper fishing, which is my favorite season. And notice the fish above my head, the biggest one. That was mine. I caught it by myself with no help. And I feel I was very successful in catching that fish. Of course, now I want to keep doing really good things in catching those big fish. But I couldn't do it without having the real tools, right? And also having an anchor and having things that are kind of the foundation for my fishing. And if you notice on the front of the boat, there's a piece of equipment called a trolling motor. If you didn't, I didn't know these existed till a few years ago. That keeps us on this spot. So once we find the right spot, it takes us there. So I want to kind of take you with me on this journey as we kind of compare a little bit of having tools for success in fishing relates to having tools for success and that back pocket of things that you can pull out to use in order to do good simulation studies. Next slide, Helen. So I want to stock your tackle box today with information on the standards and also securing your anchors. And there's several that I really consider anchors that you have to have as you move into simulation. And again, this is a list of our standards. And the top ones, you have new by them. They were new in 2021 that just came out based on the evidence that was there. So these are all things that you can put in your tackle box, right? The anchors, and we will talk about these, to me, there's some key ones here that I think are anchors, and we're going to talk about a couple of them. So next slide, Helen. So first off, this is just a quick snippet, and I know you can't read this really well on your slide, on the screen, but when you get to digging into these, when you get off a call, or if you're on another computer and you're scanning this, the standard is, each one is a different length, but just a little bit about how they're set up. So there's a little introduction at the beginning, but if you look at the arrow on the left where it says criterion, each standard has 3 to 4 criterion, up to 10, 11, or 12 criterion. So these are the major pieces of the standard. And then if you notice, each criterion underneath it has required elements. So you can notice there's criterion 1, criterion 2, and on here you notice criterion 3, create and maintain a safe environment. Then it's got listed 7 or 8 or 9 things that are really the required elements that go along with that criterion. Now, when I say required, we know that we can't always meet all of these. but we can strive towards best practice in achieving these. So this is just a little bit about how each standard is set up. There's a lot more in depth than some of the things we're going to talk about in just a minute. So next slide, Helen. So I want to give you one of the major anchors that I believe in is the professional integrity standard. And I think during COVID, when we worked on this, there were so many things going on in our environment and in our world that really led us to think bigger and better about this standard. So this standard really talks about the environment and the relationships between the facilitators, the faculty, the staff, the learners, the students, whoever might be involved, to uphold the Healthcare Simulations Code of Ethics. And you can easily Google that document, Healthcare Simulations Code of Ethics, and it will talk to you more about what we believe in simulation, being transparent, honest, having high integrity in all of the events that we develop for our learners. Also in meeting, these are the criterion of the professional integrity standard. Criterion 2 is following the standards of best practice, of guidelines of your own profession, whether it's nursing, physician, respiratory therapist, lab science, other people. Also, creating and maintaining a safe learning environment. Psychological safety is very important to us in simulation, and providing that environment for students and learners to really have an opportunity to practice what they have learned or to rehearse things that they may not be as familiar with, or maybe there has been a mistake made and they're coming in here to practice it. And notice in that criterion it says, follow the HSSOBP, which is Healthcare Simulation Standard of Best Practice Facilitation. So in all of our standards, we link them to other ones so that we know that there are other places we can go get more information on certain topics or other standards for that. Also is practice inclusion, of course, respecting that equity, diversity, inclusivity, and really being considerate of that in all of our experiences in creating cases. Of course, confidentiality, we're all about what happens in Vegas stays in Vegas. So especially if the performances, as well as the content of the simulation, especially if you repeat that simulation. So next slide, Helen. So this slide, I'm pulling out one of the professional integrity standards and looking at the elements for that one. So criterion 3 is about that safe environment. And here's listed out the elements. So of course, having a safe psychological and physical learning environment, making sure if using defibrillation or so forth that you provide safety, collaborating with others, maintaining mutual respect and shared values, especially in teams or even in single profession people working together, clear communication, always wanting to teach and rehearse this in an effective, respectful manner. And of course, really looking at the boundaries between professions, that's really important in helping and improving our healthcare teams, recognizing disruptive behavior and taking steps to abate it. So we really want to pay attention to if someone's not buying in and they're goofing off or they're laughing, really paying attention to that behavior and figuring out how do we not disrupt the rest of the simulation. And I think really it's about a mutual respect from the facilitator with the learners and vice versa. So we always want to make sure we have a good relationship with our learners in going through a simulation. Next slide. So that's professional integrity is one of my anchors. When I'm in simulation on my simulation boat and I'm traveling through developing simulation. Another anchor, a tool in my toolbox, not in my toolbox, but another tool too, is simulation design standards. And this is one that I kind of pull out, especially for novices or even people that have been doing it for a while, because it lays out here really from beginning to end, really how to develop a good simulation. And some of this can be hard to do. But a simulation design, it really has to be partnered with the content expert and the simulation expert as well. I'm not an OB nurse. I know nothing about it. So if I'm helping facilitate or design that sim, I'm pulling in those OB folks, right? Making sure you have a good match. Conducting a needs assessment. Why are we doing this? You know, is it because all of our undergraduate nursing students are struggling with assessment? Could it be that the patient safety or the resuscitation committee at your hospital is saying, okay, we have a major problem on this floor. We had certain percentage of codes that didn't end up well, or we had patients that were extubated, et cetera. So really conducting a good needs assessment of why are we doing this? And how are we going to feed that back to the group that's come to us with this problem or something that we discovered? Really setting clear objectives and considering the outcomes that you want to achieve. And that's something we'll talk a little bit more about, but really being clear. And remember, we can't solve the world with one sim. 2 or 3 objectives is really about what you need for a simulation. Although your learner expectations, you probably have multiple things for the learners that they will have to accomplish during that simulation. Also aligning the modality and making it realistic as best you can with the objective. For example, if you want to teach communication, it's really hard to communicate with the mannequin, right? So perhaps you have a person or standardized person in the bed that you can have a physician and nurse be communicating with that patient. And it doesn't mean that you can't use a mannequin, but what is the best modality? If I want to teach someone how to suture, but also how to communicate with that patient when you're suturing. Instead of a suture arm, you're going to put a real person in a suture arm beside them, cover up the top part of their arm, and you have a hybrid simulation. Does the modality you're using match their objective? Sometimes we don't have all that we might need for that, so you may have to get creative, but really thinking about that modality. Designing scenarios that are true to life, like could this really happen in this event? Maybe real patient cases that you have come around that you can, of course, not avoiding HIPAA or anything, but pulling out some labs that would really happen with a patient that is in metabolic acidosis or they're having a problem with their COPD. What does that really look like and what is the backstory? Because you're really going to have to provide information sometimes on the backstory unless the patient presents to the ER. There's no history of anything. But thinking about really making it contextual and what are you going to have to build out that scenario? Does it need to be complex? No. Depends upon your objective. We also work at creating realistic simulations. Maybe there's moulage. Sometimes we have extravagant moulage with disaster simulations, and sometimes it may be just something that simulates a bruise, and maybe there is nothing. Maybe it's just an IV, a fake IV in the hand of that mannequin. So really looking at how to make that realistic. Consider planning a learner-centered approach. So sometimes we do teaching simulations. Sometimes we do immersive, as I use the word immersive. You put them in this environment, set them on their own, they know how to get information, and you allow them to immerse themselves where they're kind of driving the simulation experience and really considering what are you doing for your students, like what's the most appropriate thing for your students or your learners. What's really hard to do is a pre-briefing and debriefing plan as you're planning it. Always plan the pre-briefing prior to the event, and we have, in the standard, we have several things that we think you should always include in a pre-brief. Others you may have to add in prepping those learners to come into simulation. A good pre-briefing will lead to a really good simulation experience. They might not do everything correctly, but it will lead to a really wonderful debriefing. And we found if you set the learners up for success, and I don't mean give them the answers to all the questions or what they're going to have to do, but prepping them for all that's going to happen in that environment and so forth is really going to help for a good debriefing session. Also, planning debriefing, you really want to make sure you have a framework for debriefing, and the standard of debriefing really digs into that. Is it a plus delta? Are you using Pearl? And those type things. There's lots of frameworks out there, so being sure you have a good debriefing. Always evaluating the learner. You can also evaluate the experience. We don't often have a checklist for our learners. Sometimes it's just the experience that we're evaluating, depending upon what the event is about. Pilot testing. I highly recommend running through your simulation before you ever do it, at least the first time, and bringing in learners that may be similar situation, maybe early learners, or maybe it's a staff person, whomever. Pilot test the whole entire thing if you can. This is a hard thing to do, but it really helps you work out the kinks and the cues and clues for that. So next slide, Helen.
Dr. Watts, before I move to the next slide,
so that's the simulation design standard, which really kind of connects to other standards as well. So next slide. I'm sorry, Helen.
Yeah, no worries. Actually, we had a great question that came in. I figured now might be a good time to pause and answer that if you're okay with it. The question is about rehearsing, and it says, where does rehearsing?
Well, maybe we have a little technical difficulty.
Can you not hear me? Can anyone hear me?
So we'll hold on just a second and we'll get that slide moved forward. So some of the other standards that we're going to move forward with is we're going to be looking at, thank you so much. I was going to see what I could remember for the next slide. Thank you. Outcomes and objectives. So we talk a little bit more about this. What are your expected outcomes? Why are we doing this? What do you want them to have learned or have met by the end of the simulation? Creating SMART objectives, really making them measurable. Are they achievable for these learners? Are they prepared for this? And really considering the proper modality and fidelity, and consider if you have an embedded participant, it used to be embedded simulation participant, we call them ESPs, or now it's kind of EP. Maybe it's a nurse helper that's in the room that can kind of navigate some of the sticky wikis that may go on with your environment, working the equipment, etc. How much cueing do we give? You know, do we have a family member in the room that can help kind of push something, push the scenario along if needed? So in this standard, you can really dive deeper into each of these criteria on really developing your outcomes and objectives. Next slide. I can't see everyone, but I'm curious. Hopefully most of us have engaged in some type of interprofessional activity or simulation. I know in a lot of healthcare settings, the trauma team rehearses together, the OR teams work together, and I teach in academic. Now I did some in the hospital. We run mock codes with our students. We may have other professions come in and just manage the care of a postpartum hemorrhage type patient. But there's a lot more to simulation enhanced IPE. And in this standard, it really goes more into depth in the standard, considering it has to be based on a theoretical or conceptual framework. That could be team steps. You know, I'm not sure what your institution uses, but having some type of framework for you to move forward with your IPE simulation. Best practices for development, like I said, the standard goes into in-depth, but I should not go create this big simulation and then go, oh, respiratory friends, come on in and do the sim with me, or physician, come on in and do the sim with me. We've done that many times here at my facility. We have done that, and trying to do better about all coming together at the table to say, where do we meet? Where are those boundaries between our professions that we need to work on? Communication and teamwork. And sometimes it's not even about the case. It's really about getting those professions together to talk and work together and go, man, I really didn't explain what I was really meaning when I gave those orders, or, you know, I don't understand that piece of it. So pulling the professions together to develop that simulation. And I've been doing IP here at UAB for probably 12, 13, 14 years. And there are so many barriers to it. People stop and quit. And you can't give up. It can be small, but the work I've seen and the way healthcare is today is much different than I was a nurse in the emergency room 32, 33 years ago. So we're making progress, but really it's a different beast. I think you should always consider having multiple professions in the debriefing. You have co-debriefing where you can co-debrief. That's a skill that can often be difficult, but really bringing people to the table for your learners. And this standard helps outline some of those things. So, next slide. So operations is really a big one to me. And for all of you one-person show folks, you know, I know there's a lot of us, I can't see your hands, but maybe click on the raise hand button. How many of you actually have a one-man show, or you've been doing this for a while? There's nothing about operations that you don't know as a one-man show or a 20-man show. So looking at the criteria for this, it's really important for us to consider all the things that go into making this happen. Supplies and space, equipment. Do we have enough people to run the simulation, to run the mannequins or the equipment or the telehealth equipment? Do we have the right IV pump? You know, is it from 1942 or is it a current pump that we're using? Thinking of the logistics of implementing these type simulation programs. Thinking of the personnel, do you have the right expertise to really support and sustain your program? And I think a lot of hospitals really are growing over time, and they have that one-man show type thing. And I think that's really an important thing to consider is how do you all work together to make all of these little things happen? A bigger thing when thinking of operations is a bigger picture of your program. What is that strategic plan? What are your goals as a center or a program? Do you have the resources? And this standard can really support you when you're talking to leadership in your institution or in your organization, and aligning the resources that you have to meet those goals. You know, we always have to have a vision, or where do we think we can go and what can we be successful in? And it's important to think about that strategic plan and what your goals are moving forward. I would be remiss if I didn't mention money, the financial resources to support the program, stability, sustainability. And I promise you, if you start doing STEM, more people are going to come, right? I think that's really an important thing to consider is the financial stability of it. How do you sustain it? How do you grow your goals and your or to reach your goals and outcomes? And that might take getting buy-in from leadership, doing things that show improvement in patient conditions, and maybe some of the things risk management has contacted you about. So I do think that operations supports the fact that you need a formal process for effective systems integration. And this is where you really look at how is that SIM team really embedded in the whole, let's say, hospital, in the clinic, or wherever you are. Is there a patient safety committee? Someone from the SIM team should be involved in that. What are things going on in the hospital that maybe SIM could be an answer for? Or maybe the SIM team has noticed, hey, we've been running a lot of these SIMs. I'm bringing this to the risk management group. We've noticed X, Y, and Z. Or the resuscitation committee. So, hey, we've been conducting these first 5 CPR classes or simulations, and we've noticed these 5 things have been happening. And just wanted to bring it to your attention. How can we help? We can work together to kind of come to this, to make things better for our patients. Having policies and procedures, and I'm telling you, this is one of the hardest things. We are actually redoing ours. We had a pretty shallow group of policies and procedures, and we're going through them right now. We're working on our School of Nursing now. Our UAB SIM Center is accredited, but we're working on the School of Nursing Center being accredited, and it really looks at program evaluation. And that accreditation program is in Society for Simulation in Healthcare. And it really supports you having a robust set of policies and procedures. So you one-man shows or you 5 or 6 people, this is a lot, but getting something on paper, which we've had for years, is a really important thing. So a little bit on operations, which we all have to, this is kind of the glue that kind of keeps us moving. So this standard will hopefully support you in that. So, next slide, Helen. So professional development, and this is near and dear to my heart, and I do see I have a question in the chat box I'm going to get to in just a minute, so thank you. In a professional development world, simulation is changing and growing all the time. And I live in the literature. I'm kind of a nerd about that, articles and books, and going to conferences and webinars such as this. I really want to learn as much as I can to help my team, to help my practice. I've been debriefing for 15, 16 years, and I feel I'm pretty good at it most of the time. I'm always going to debriefing classes. I always want to get better and stay good as a simulationist. So this is a fairly new standard. And if you notice, it's a pretty simple standard because these apply to all simulation programs around the world. And many center simulation programs do not have access to a lot of training. They may just have one conference, or maybe they only have access to articles or books. So this supports us keeping current with the new knowledge, providing high quality experiences in simulation, as well as meeting those needs of our learners. And the 3 major criteria in this is doing a needs assessment. If you're an educator, you've been teaching for 20 years and you're moving into SIM, you already know quite a few things. So doing an assessment of yourself in relation to the needs for being a simulationist. And there's actually a website that has a new tool on it called the SENAT, S-E-N-A-T, assessment tool, where you can kind of do a self-assessment of yourself on where am I lacking, or pulling up the certification for simulation blueprint, like what do I need to work on? I'm not a standardized patient guru. So if I have to use them in my lab, I'm calling my friend, or I'm looking up or finding a webinar or something on that. So finding out what I need to work on. Participating in professional development activities, just as this webinar and others, it's really going and being searching for new knowledge or what's going on out there in the professional development world for simulation. There's so many things, free podcasts, webinars, to help you get better. And whether you agree with all of it or you think you can use it in your practice, you can really glean 1 or 2 nuggets. Everything that I listen to or read, I can glean a couple of things that can really help me in my practice. And ongoing is really reevaluating your professional development plan. And with my team, I really look at, so I have a new SIM coordinator, and she said, I am not really good at debriefing. She just started SIM coordinator. She can do everything else. I struggle with debriefing, and I said, fine, let's get you in a class. I'll go with you. I'll mentor you, I'll coach you, and then we'll push you off a cliff and let you do it, and I'll give you some feedback, right? So really looking at yourself over time and saying, man, those evaluations said this, or those evaluations said, hey, that you need to work on debriefing. I don't know, whatever it might say, but it helps you reevaluate, who you are and do better. So next slide. So I think for looking at where you are in the VA system, there's a lot of things that you can consider. And in working with John and Helen and thinking about the things I'm passionate about, because I've done healthcare or hospital simulation and practice simulation as well, is what are some of the things that you can consider? So I've just kind of listed a few here. Streamlining training and competency, and that's always a challenge. We're challenged here with our nurse residency program, with our undergraduates, but what is that curriculum for training? What are those skills, competencies that all of our new staff need to meet? And it's not just a psychomotor skill, there's a lot more to that. And how to evaluate learning. The standards may provide a framework for you in conducting this and really streamlining the work that you're doing. Enhancing patient safety. This is number one. I think in the academic setting, we try to do a good job with our students and learners. Of course, they come out and they have, quite a ways to go. But in the hospital, I think you are truly at the point of affecting patient safety and patient care. And there's so much that can be done in caring for our patients and using simulation, even teaching our patients using simulation. I know a lot of places are using simulation to train their patients in trait care, going home and caring for their family member with certain things. So the standards can provide guidance in helping you create those experiences that are really going to lead to reduction in errors, medical errors, improving judgment, and having that culture of always wanting to improve and get better. And I know in the hospital setting, when we started doing in situ simulations here, which are doing them on site, at the bedside, wherever you're at, it was a struggle, right? It's a struggle. So really thinking about how do you get people engaged in that and really owning being in simulation and making things better. Fostering interprofessional collaboration. There's so much of this that goes on in the healthcare system. Is how do we integrate IPE simulation into the healthcare setting? And how do the standards of best practice really support that mission and bringing it to the bedside? And what does it look like, right? Because interprofessional simulation, looks a little bit different. So hopefully the IP sim standard can really support your work in doing those within the clinical setting. Nurturing that continuous professional development, and hopefully a lot of the facilities and your institution may be different, provide some type of professional development, really growing and helping them get better as clinicians and also as simulationists. So really nurturing that professional development for doing excellence in simulation and having high quality, but also helping your staff continue their development as well. I do think, and this is the last one that I'll kind of talk about here, is with the operations standard, which is a really robust standard, and I know they're going through a whole other iteration because these things take several years to do in reviewing the evidences. They might even break that one up. I'm not sure how we'll go forward, but there's a lot in there. Resource allocation, personnel, equipment, facilities, buy-in, working with leadership, and how do we make simulation so impactful, but what are the resources we need to make it happen? Joint Commission is actually recognizing simulation, especially in the maternal child area. But how do we have resources to do that? So this standard really is something that can help you with optimizing resources for being successful. Next slide. So thank you. So I do have one question, and I'm not sure if other people can speak, Helen. I'm sorry I didn't hear you earlier, but I don't think I touched anything, but I may have. So one question that came about was, spoke to rehearsing, and can you speak to that more in depth? Whoever posted this one, they're a firm believer of rehearsing, and I'm not sure where in the standards it speaks to that. So I wish I had memorized them, so I can't remember exactly if it actually states rehearsing. However, when you think of formative learning, and that's in the evaluation standard, formative is that ongoing learning. Where are you? Where do we need to go? I firmly believe in rehearsing. I think doing a simulation 1 or 2 times would be great. I think the limitation is that time. Get our learners in, get our learners out, you know, that type of thing. So that's often a problem. But I absolutely believe rehearsing is important. And if you're doing some type of summative simulation, maybe in a nurse residency, or post, maybe they're going through a critical care type program for summative, I think students need to be prepared to do that. So absolutely. And I like the idea of rehearsing. So you keep it up, and I'll look for that standard if it says it anywhere. But I think the formative learning and the evaluation one would help you speak to that for formative learning. So John, there's another question it looks like. Where would you go to for a needs assessment? So I'll have to get Helen to send this out to everyone. There is a website, and I can send this to Helen if I can find it. They're building a new website, so it may not be live. It's an evaluation website by Kim Leighton, Leighton, and she worked with a friend, Teresa Britt, who was out of Tennessee, who had developed a needs assessment. It's a very simple document, but it's called the SINET. I think it's Simulation Education Needs Assessment Tool. That can kind of help you briefly think about where you are in simulation. I also suggest the CHESE, the CHSE. So there's a certification in simulation called the Certified Healthcare Simulation Educator. It's also one called the Certified Healthcare Simulation Operations Specialist. There's 2 certifications that you can get, test type certifications. They have a blueprint, which is actually based upon a practice analysis which we conduct in our society, the SSH, Society for Simulation Healthcare, around the world, in developing what our simulation is doing and what is our practice. So it outlines the domains and the topics that are actually within the practice of the simulationist. And actually, we just finished a practice analysis, so some of the revision to some of those exams will be going on for this next year. So you should see that. So I also suggest using the domains on that blueprint, and you can Google CHESE certification blueprint, and it should come. It says like educational modalities. There's a whole bunch of things listed, and like one of the things listed in there is standardized patients. So I am not a guru on that, so I would have to really look at that in order to take the certification. But that's another way that you might use for conducting a needs assessment. So. John, I'm free for questions, or Helen, if anyone. I'm just seeing these that popped up from John. So.
Yeah. So, Penny, can you hear me? First of all, can you hear me?
I cannot hear anyone. I'm not quite sure what happened.
Okay, I'm not sure either. What I was thinking was that we might open it up to the team, to our guests, to see if anybody had anything specific that they wanted to ask about their individual.
I'm not sure why I can't hear you.
Well, she can read anything that we
chat
drop
me,
into the
but
chat.
I'm gonna have to figure that out.
Yeah. So if there are any additional questions, let's drop them into the chat so that Dr. Watts can see them.
There you are. I don't know what happened. It was stuck somewhere. I'm sorry. I'm sorry, guys.
No, you're fine.
Technology. I'm sorry.
Someone said it's a full moon, so that might be it.
Right. So one of the things that I wanted to talk about real briefly, my background is also in sim. I was a simulationist as a customer for many, many years before I came to Laerdal. And one of the challenges that we had back in the day is that we didn't have any standards. We literally were flying by the seat of our pants and inventing it as we went, trying to find ways that were successful against ways that weren't. So there were days when it felt like each of us were reinventing the wheel. And having been working with the VA for 4 years now, and visiting many, many of your institutions, the commonality that I see is that it's what everybody says. If you've been to one VA, you've been to one VA. Each and every one are different, and they bring their own cultures and their own special, unique conditions. Having said that, particularly folks that are using a one-man show or one-man operation type situation, these standards are evidence-based, right? They didn't just get invented. This is created through research and evidence. So if you're trying to leverage within your organization to garner resources, whether it's equipment, space, or personnel, these standards should be your starting block. You don't have to reinvent the wheel. It's already been invented. And I can't tell you how many different places I've spoke to about the standards. And one, they weren't aware that they existed. And two, they had no idea that they could use this as a resource to make their arguments for things that you're experiencing every day. So I would encourage you to download the standards. They're free, and take the time to read them. Each standard is reasonably short. They're well written. While they are academic papers, they are written to be read and applied to your organization. So I very much would encourage you to take the time. And just as an additional little tidbit that I'll throw in, this is the first in a webinar series that we're going to be doing on the standards. So moving forward, we will take a deeper dive into one or two standards at a time. So we already have the next date. Helen, I don't know it right off the top of my head, but oh, there we go. There we are, November 15th at 1 p.m. So feel free to register. We would love to get into this a little bit deeper and have a more in-depth discussion on each of these standards, because it is something that I really believe very passionately about. I really do. Penny, anything else?
Well, Helen, I can't message everyone. I don't think I tried. I'm just having problems today. The website for the evaluation tools, it is currently down, but you can see the list of the things, and there's an email of Kim Layton. It says huskerrn@gmail.com. You can email her for a list of the tools, and she will definitely help you. She answers. She's in Qatar, so her timing may be different, so I'll give her a day or two to answer you. But it's a great website for evaluation tools, and that particular tool is actually on that website as well. So.
There we go. I just dropped it into the chat for
Thank
everyone.
you. I know I couldn't.
Yeah, no problem. So yeah, as John mentioned, we have our next webinar. It's going to be on November 15th. So we would love for you all to join so we can keep the conversation going. And actually, if there's something specific you guys want to talk about during that webinar, drop it in the chat right now, and then we'll make sure to add that to our agenda. And we'll focus on that for the webinar. So it's sort of an open format right now. We would love to focus on exactly what you're looking for. And if you're looking for any specific guidance, we can do that for you. So just drop it in the chat and let us know what you want to hear, and then we will incorporate that into our webinar. Also, just one additional note is that we actually do have a short version of the standards here. This is located on an Axel's page, but if you scan this, grab your phone, scan it, it'll take you to the standards as well, and then you can click further to see the more detailed breakout of the standards. But this is a great place to scan if you have your phone handy.
There's a question, I think, for John on there, but the other one that Charles asked was, what would you tell a team that is in startup mode? Oh my gosh, this is one of my favorite questions, because I was at one, it was me and a teaching assistant and one lab, and now we probably have 15,000 square feet 17 years later. But I know the feeling of where you're in, you're starting. I don't know what your situation is, how you're getting moving. I think the best place to start is just to take an hour or two with you and your one other team member, whoever, to kind of look at the standards globally and generally, and think about, where do you want to start? Like, what is the biggest sticky wicky for you right then? If you don't know, I recommend starting first with the professional integrity. This is Penni Watts' version of where to start. The professional integrity standard, just from how to frame your work in simulation. The second one I would recommend would be the simulation design, because that standard can really lead you to all the other different pieces and parts of the other standards with that one. If you're in a startup mode and you got everything but not debriefing, maybe go to that standard. So you can kind of pick and choose a couple of those standards. I think facilitation is another one, because we often don't know how to facilitate appropriately. You know, we use what we call ESPs sometimes, or EPs. They kind of help in there, but how do you do it when I'm a one-man show or a two-person show? So I hope that helps, Charles, in kind of what you're thinking of. I think, don't think you've got to put them all in place at once. We're still working on how do we get some of these in place. So it's a guide. It's to support you, not to hinder you or to overwhelm you. And I know Helen and John have my email. They can pop it in the chat, whatever. Email me. I'll be glad to hop on a call. I do it a lot for people because I understand where you are, and I was in that same boat. But there's a lot more out there to help you than there was when I started, because I did a lot of wrong things. According to standards now, I was kind of making a few mistakes, but we survived. Hope that helps, Charles, a little bit.
Definitely. Thank you. And then there was another question that came in, an anonymous question. So John, I'm happy to take this one. So it says, Laerdal put together an amazing escape room toolkit. Is there a chance there will be more toolkits on the way? Something like ROI or SIM? And then the question just went away. But yes, no, it's okay. To answer the question, yes. A million times yes. We are always coming up with great resources, lots of new content. We actually have a specific content writer on our team who comes up with a lot of these great resources. So we have a section on our website. It's laerdal.com/resources, I believe. I will drop it into the chat here in just a moment as well, and I'll share that with you all after the webinar is over via email. But we have ebooks on there, we have videos, we have lots of on-demand videos, different toolkits that have been created as well. So definitely take a look at that. There's several good resources, but I'll share it with you, like I said, in email so that you guys can have direct access to it. And if there's something specific that you're looking for, please just let us know. And we, like I said, we have a great team of content creators on our side, so we can definitely get something created if you feel like it's very relevant for the market. So just let us know, and you can even tell me now. Just drop it in the chat and send me a direct message, and I will get that on our list.
Helen, the last line in that question was something like ROI or SIM from beginning to end. So
yeah, okay.
Sorry about that. Perfect. I answered the question as you were, and I made it go away.
Awesome. No problem. Great. So, and just one last thing, I just wanted to share. We have a couple of additional QR codes here that I would love for you to scan if you have your phone handy. The first one is just product information. So if you're interested in Laerdal's Nursing and Simulator Geriatric, this is a great product that we have, and there's tons of great information about it on our website. Feel free to just scan that. Or if you're even interested in just other Laerdal products and services that we offer, feel free to just scan that and poke around on our website. Another thing is, I just wanted to plug this because I am personally working on this on our team. We are doing a national Sun conference, and it's a conference where we invite simulationists from all over the nation to come together and network, share resources, collaborate, really do a lot of great just hands-on experiences. There's so much that takes place at this conference, and it's November 1st through the 3rd in Orlando. I would love to see a lot of you there. I see your names here. I would love to see you at the actual conference. So scan that, take a look at our website and see what we have to offer. I'm pretty positive you will be very pleased, and you'll be thrilled that you joined us if you're able to. We also have a justification document on our website. So if you need to justify the cost and why you want to go, you can easily just download that and then fill in how much it would cost for your hotel expenses and travel accommodations, and then join us at the conference. It's going to be super exciting. So if you have any questions about that, again, feel free to just drop that in the chat, but I wanted to personally invite all of you to that. And with that, I think Or do we have any more questions? I think we are good. Okay, well, we will just go ahead and wrap it up. Dr. Watts, thank you so much for joining us today. We appreciate all of your insight, and we look forward to having you again on November 15th at 1 p.m. Eastern time. So thank you all for joining. Have a great day.
Thank you, everyone.